You know, when you hear the words kidney stones, your mind probably jumps straight to one thing: pain. And yeah, you're not wrong, it's famous for a reason. But what if I told you that pain isn't the whole story? What if a kidney stone is actually a really important message from your body about your long-term health? Let's get into it. First things first, if you've ever had a kidney stone, you are definitely not alone. Get this, in developed countries, more than 10% of people have had them. That means, in any group of 10 friends, there's a good chance at least one of them knows exactly what that pain feels like. It's way more common than you might think. And here's the kicker. It's not a static problem. It's actually a growing one. In some places, we're seeing a jump of over 37% in just the last 20 years. So this isn't just a random series of unfortunate events for a few people. It's a real public health trend that we need to get a handle on. So here's our game plan for today. We're going to look at what these stones are actually made of, figure out who's most likely to get them, and then, and this is really important, we'll uncover the link to chronic kidney disease. We'll wrap things up by looking at the fascinating genetic clues behind it all. All right, let's dive right in. What are these things even made of? Because, you know, if you want to figure out how to stop them from forming, you first got to know what you're up against on a molecular level. And here's a really key idea to start with. It's not just about what the stone is made of, but why it formed in the first place. Understanding that why is literally the most important part of prevention. Generally, we can lump the causes into 4 main buckets. First, you've got your non-infection stones. These are the most common ones. Then, there are stones that pop up because of an infection. Some are tied directly to your genetics, and believe it or not, some stones are actually a side effect of certain medications. So, what's in the recipe? Well, while there are a bunch of different minerals that can be involved, these are really the big 4. Calcium oxalate is by far the most common culprit, but you also see calcium phosphate, uric acid, and struvite stones, which are the ones often linked to infections. Knowing the exact type is a massive clue for your doctor. Okay, this all leads to a really critical question. Who is actually at high risk for making these things? Because after you've been through it once, there's only one thing you want to know. Yep, that's the one. It's the question that hangs over anyone who's ever had to pass a stone. What are the odds I have to go through that again? Well, the data is interesting. If it's your first time, there's about a 26% chance of getting another one within 5 years. Now, if you do have a second one, there's basically a 50-50 chance it stops right there. But for the other half, it can turn into a chronic problem. And that's exactly why figuring out if you're high risk matters so much. So what puts you in that high-risk category? Well, things like getting them when you're young, if it runs in your family, or if you form specific types like brushite stones or uric acid stones. And of course, if you only have one kidney, preventing another stone becomes absolutely essential. And remember, stones don't just happen in a vacuum. They're often connected to other health conditions. Stuff like metabolic syndrome, having pre-existing kidney issues, or certain GI diseases like Crohn's can seriously ramp up your risk. Even a history of bariatric surgery can be a factor. And finally, your own body's structure and even where you live can play a part. An unusual kidney shape, for example, can make it easier for stones to form. And get this, so can external factors like living in a really hot climate or even chronic exposure to things like lead or cadmium. Okay, we've talked a lot about the risk of getting another stone, but now we need to shift gears and talk about something much more serious: the connection between kidney stones and long-term kidney damage. This is where a stone can go from just a horribly painful event to a real chronic health threat. You can think about it like this. The first level of worry is, am I going to get another stone? But there's a next level, a much bigger concern, which is the risk of developing chronic kidney disease, or CKD. And these two things are very often connected. So just so we're all on the same page, what is CKD? Simply put, it's the slow, steady loss of your kidney function over time. It's serious business, and for some people, having kidney stones can actually be a contributing factor. And here's a crucial point. Not all stones are created equal when it comes to CKD risk. For someone with, say, brushite stones, the risk is moderate. But if you're dealing with cystine or struvite stones, that risk jumps up to high. And for people with rare genetic disorders like primary hyperoxaluria, the risk of CKD is very high. This is why it's so incredibly important to figure out what kind of stone you have.
This brings us to the last and maybe the most mind-blowing piece of the puzzle, the powerful role our own DNA plays in all of this. Okay, check this out. The estimated heritability of kidney stone disease is around 45%. That is a massive genetic influence. It means that for almost half the people who get them, the tendency to form stones is literally written into their genetic code.
So, does that mean everyone should run out and get genetic testing? Well, not quite. Doctors typically start thinking about it for people who get stones at a really young age, for anyone who's had 2 or more, if there's a super strong family history of stones, or if other symptoms just point toward an inherited issue. But finding that genetic link can be a game changer for getting the right treatment. So we kind of end up right back where we started. After looking at what stones are made of, the risk factors, that scary link to chronic disease, and the genetic markers, we have to ask a totally different question. Is getting a kidney stone just a random roll of the dice, a bit of terrible luck? Or is it a really complex signal, a message about your metabolism, your anatomy, and even your family tree that is absolutely worth listening to?